Hi, I'm Luke Margolis with Atlantic Health System. Thanks for listening to our latest podcast. On behalf of all the doctors, nurses, and other team members committed to building healthier communities, we're proud to share the latest news from across our system. For health tips and other life-saving information, visit atlantichealth.org.
Welcome to this week's Mind Your Mental Health, a podcast series brought to you by CONCERN Employee Assistance Program, a part of the Atlantic Behavioral Health Service Line. My name is Nick Carter. I'm a licensed clinical social worker and the coordinator of CONCERN. And I'm here with...
Hey, I'm Sharon Kelly, licensed clinical social worker. And this is the second of our four-part series talking about how we can all help knock out opioid abuse and addiction. Hey, Nick, listen, could you help our listeners by giving them an overview of some of the different types of opioids that are out there? I know we did it last week, but let's do it again.
Yeah, it never hurts, right? Okay, so we have oxycodone, we have OxyContin, we have hydrocodone, we have Vicodin, and morphine, just to name a few. And then the heroin that we're all reading about in the newspaper frequently, which is an illegal opioid.
Yeah, unfortunately, we seem to be hearing about these opioid addictions of all kinds all the time. But last week, we talked about some of the reasons that a person might be prescribed an opioid. So let's discuss the kinds of questions someone might have for their doctor.
Yeah, we talked about getting a surgery and tooth pulled or something like that.
Right.
I mean, these opioids are powerful pain-relieving medications, and they are effective, and they do work.
Mm-hmm.
It'd be a good idea to ask if there are any other options for pain management and what kinds of interactions there might be with any of the medications that you're taking.
You know, I'm also thinking that they might want to ask their doctor, like, how long do I have to take these medications?
Yeah.
Nick, we said last time that a person could become dependent or addicted to opioids even if they're prescribed by a doctor. Such an important thing to remember. But how would somebody know if they are starting to lose control of their prescribed use?
Right. So the first thing we want to emphasize, Sharon, is that we really encourage people not to be embarrassed, to speak up and ask their doctor more questions.
So important.
Yeah. But if a person starts to feel like they're needing more of the prescribed amount, they should discuss that with their doctor. They may experience urges and cravings that compel them to seek out some non-prescribed opioids. Or they might find that they are using the opioid to manage their emotional pain. These may be warning signs of a growing dependence, and they need to pay attention to this, and they need to consult their doctor.
Really good information. And we want to thank everyone for listening to Mind Your Mental Health podcast. And check in again next week for more information on how we can all help knock out opioid abuse.